Hey there. Ever wondered what those little pills are doing to your body? What are immunosuppressants? Immunosuppressants are medications that dampen the activity of the immune system. You might be thinking, why would I want to do that? And you're right. Your immune system is like your personal bodyguard, always on the lookout for threats like illnesses and injuries. But sometimes this bodyguard gets a little too trigger-happy and starts attacking the body's own cells. That's where immunosuppressants come in handy. They're like a calming influence on the immune system, helping to stop the body from attacking itself. But why would someone need such a thing? Well, some folks have autoimmune diseases like rheumatoid arthritis, lupus, or inflammatory bowel disease. In these cases, the immune system is basically set to attack mode, causing inflammation and damage to healthy cells and tissues. Immunosuppressants can step in and help restore balance, reducing the severity of symptoms and helping people live better lives. Then there are times when our bodies get a little too enthusiastic about defending themselves against foreign invaders. Severe allergies are a great example. When someone with a severe allergy encounters the allergen, say peanuts, in a meal, their immune system can overreact. This can lead to anaphylaxis, a potentially life-threatening reaction that makes breathing difficult and can cause the blood vessels to expand dangerously. Immunosuppressants can help manage these reactions, providing some relief for those with severe allergies. But perhaps the most common use of immunosuppressants is after an organ transplant. When someone receives a new organ, say a kidney, the body can sometimes see this as a foreign invader and try to attack it. Immunosuppressants can step in to prevent this from happening, helping the body accept the new organ as one of its own. Now that we know why they're used, let's talk about how they work. Immunosuppressants are a diverse group of medications, each with its own way of calming down the immune system. Some common ones are corticosteroids like Prednisone. These are like the general anesthesia of the immunosuppressant world, powerful stuff that can reduce inflammation fast. They do this by blocking the chemicals that cause inflammation, giving the immune system a chance to chill out. But they're not without their quirks. Corticosteroids can cause weight gain, mood swings, and other side effects, so it's important to use them wisely. Then we have the calcineurin inhibitors like Cyclosporine. These medications work a bit differently. They block certain proteins that help T cells, a type of white blood cell, activate and multiply. Without these proteins, the T cells can't coordinate an attack on the body's own cells. But here's the catch. These medications can lead to kidney dysfunction if not monitored closely, especially over long periods of time. So patients on these drugs need to be diligent about checking in with their healthcare providers. There's also a class of immunosuppressants known as biologics. These medications are like guided missiles, targeting specific parts of the immune system. They often go after proteins or antibodies that are involved in triggering an immune response. By neutralizing these components, biologics can help fine-tune the immune response, reducing inflammation and the risk of rejection. Now, you might be wondering, are there any downsides to these helpful medications? Of course. One of the biggest risks is an increased susceptibility to infections. When the immune system is dampened, the body becomes more vulnerable to illnesses. That's why people on immunosuppressants are often advised to take extra precautions, like avoiding large crowds or getting extra doses of certain vaccines. Some immunosuppressants can also have serious side effects. Corticosteroids, for instance, can increase the risk of infections, osteoporosis, and high blood pressure. Calcineurin inhibitors like cyclosporine can lead to kidney problems and other side effects. It's a balancing act. Immunosuppressants are like a constant balancing act between managing the immune system and minimizing the risk of side effects. It's a close line that patients and doctors walk together, adjusting medications and monitoring for any signs of trouble. Understanding these medications can help you make informed decisions about your health. It's all about finding the right balance. That's all for now. See you next time.